Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello everyone. Hello Jorge Andre. How are you?
I'm fine. How are you?
I'm good.
Hope that the last episodes my sound is better. I think we are improving. I'm trying not to forget to keep my mouth close to the microphone, but I think we've been doing better. How are you? Almost on vacation, Manuela, right?
Yes. I'm going to take 2 weeks of vacation. So the last 2 weeks of July. Yes, I'm looking forward. I have a no PC rule. So this time I will not connect my my
Nice.
PC. Also because I'm going to be staying in a place where I don't have much internet connection, so I don't want to go through the
Good.
frustration of wanting to do something and not being able. And also because what I need to there are certain things that I need to be connected, of course, and to need to reply and certain emails that I have to see and certain things that have to be done. I can do it on my phone. So
Nice.
it's going to be good. What about you? How are things?
So I like that. So you said, well, I have a no PC rule. And I thought, well, there's no work. But then you said, well, but
No.
one of the things
Yeah.
that I have to do, I can do on my phone. But actually, let me tell you one thing. There's a lot of things that you can do on your phone,
Yes, yes,
right?
yes, 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 yes,
You can
yes.
type long emails, but I'm sure you can answer emails and this and that. And
Mm-hmm.
sometimes those little things that take ages. Even for example, today I had a day off, and I was like, okay, so I'm just gonna sit down and answer some emails for an hour before surfing, and it took me like
It
one and
takes
a
a,
half
it takes a,
hours.
it takes a lot of time. Yeah.
Yes.
Yeah.
Yes,
Yeah.
yes,
Yeah.
because you get
Yeah.
distracted, you go to social media, and then you are writing an email, and then someone answers the other email, and then you go back, and yes, it's you have to be really
Hmm.
well organized and focused in order to be
But there are
productive. But
there are
yes, I think it's a
certain
good start. It's a
there are
good
certain
start
things
not to take the PC.
that I cannot disconnect. I have to give answers, and I have to be
Yes,
able
of
also for not
course.
to be worried and to be able for things to flow, because there are things that
Yes,
are depending on my decision.
yes. I
So
have a
that
name
I
for that. You know what's the name for that? You
tell
work
me.
on your own. You're an entrepreneur,
Yeah.
right?
Yeah,
So
that's it.
that's it.
So I, even for me, to be able to be well and
Relax.
to not be worried.
Yeah.
And yeah, so there's always a certain part of my day that I know that, but okay, it's part of my day, so it's not it's just 1 hour, 1 hour and a half, 2 hours, and it's done. But what I mean by not taking the PC and not opening the PC, it's because um, the PC to me means the creative work. So now I'm developing, for example, I'm recording a mindfulness course, a new mindfulness course. I'm in the process of
Mm-hmm.
recording meditations because I need it to do
Mm-hmm.
that. And and that takes a lot of energy, something that I love to do, and it's something that it really, I think it's the fun part of my work. But it
Mm-hmm.
takes also a lot of me, a lot of energy. And and I'm for me also to be able to go in vacations in a way that I'm totally relaxed. I know that I have that under control. I know that what I was supposed to do until I go to vacations, I'm going to do it. I'm going to end it this week. And when I return from vacations, I know exactly the work that it's still waiting for me to be done, and I can finish it on the deadline that I propose to myself. But when
Yeah.
I'm in vacation, I can relax, and actually I have more insights, and I always have something
Of
with me to
course.
write and to, I can add this and I can add that. So it adds to that creative part. But yes, for the logistics part of my work, I cannot completely disconnect, like you said. It's all on
Yeah.
me. So it has to
Yes,
be.
but I have the same thing, and I don't think it's necessarily bad. Like you're saying,
Hmm.
sometimes
No.
you need that balance
Hmm.
because when you have a creative work like you do, you need to. I mean, everything is a creation, isn't it? I mean, and so you're on vacation, but you also take some time to get some notes and stuff. So I completely understand you. You were asking me. Well, I'm going. I'll have 2 weeks in August, and then I'm going to start traveling for work/vacation to Trinidad and Tobago, and then to Malaysia, and then to Australia. And it's going to be the second half of the year. I'll be having a lot of traveling. The first half I didn't, and it was good because I had some amazing vacation in Costa Rica in the early of the year. So it was good because I had the things that my practice needed me to be around, some construction work that was finalizing, and there were some cases that needed some follow up. And yeah, looking forward for the vacation, the second part of this year.
Nice. And we
Feeling
have our
ready?
course also in Algarve in October.
Yes,
So we're
we
going to
have
be
our
together
course in
also.
October.
Uh-huh.
Exactly. That's
I
it.
have
That's
actually
it.
a challenge for you. I still didn't told you, but I will. It will be here on a recording. I think that next time that we're going to be together in October, we should make time
Hmm.
to record a podcast
A
episode.
podcast there. That would be nice.
Together live
That would be
instead
so
of
nice. Yeah,
we
that would be
have
nice.
to arrange that. So let's make that compromise
Yeah,
here on
nice.
on the
In
record.
Sagres. Yeah,
Yeah.
we can talk about the course actually. We can talk about the course.
Yes, because it's
Yeah.
an amazing vibe,
Place, yeah.
and also we never done it. We always do it like this, and I think it will be nice to have an episode with both of us. Really
Yes.
having
Yeah.
a conversation side by side. I think that would be fun.
All right, we have a deal.
So today we're going to talk about something that you proposed.
Yeah.
I think the last time that we talked, and
Yes.
that is how to deal with criticism, and not only with criticism, but also with haters. Because nowadays with social media, and we talked about social media several times already in the podcast, is something that it's part of our lives, and it's a big part
It is.
of not only our lives, but also you cannot ignore it, the power that it
Yes.
has on our work and promoting our work also. And but with social media came also another type of criticism, which is
Yeah.
the so-called haters, which goes beyond
Yeah.
criticism. So that's what we're going to
Hmm.
talk about today. So I think that for people like you and me that go a little bit out of the norm, of the normal
The
rail,
privacy. Yeah.
and that do other things, and talk about other subjects besides only the most conventional part of dentistry. I think that we have to
More
be able to
exposed.
deal with that in order to continue to do what we are doing. Don't you think so, that we
Yes.
have to build a little bit
It's
of resistance to to
That's very
to,
funny
to
the way
that?
that you put it. It's very funny. Actually, I propose you this. I had some people that asked me that question regarding the way that they should be placing their social media and doing posts regarding their clinical practice and regarding some clinical cases, and also saying that. Well, I know if I expose myself and start doing some clinical cases, my friends will believe that I will be showing off, and my friends from college will be believing that I'll be showing off, and then also my non-dental friends will think it's weird and stuff like that. And I said, well, then, yeah, that's a good theme for the podcast, because I think that what other people think of ourselves occupies a greater place in our mind more than we would like to admit. And of course, this changes throughout our life. Of course, I mean, if you're in adolescence, it's probably huge, right? Because there's your hormones are like pumping up, right? And you are in the process of developing your own personality and stuff like that. But I think that as you get older, it starts to fade away. But as you said, if you live not very exposed profession or not very exposed life, sometimes it's that question is not very important. But like you say, if you expose yourself, and of course today we have to talk about social media because that's the center of, I wouldn't say it's a center, it's a big extension of our personal and professional lives. And if you market your work, if you or if you just like to share with your friends a little bit of your life and what you do, it's always it's always a difficult balance between what is ego, what is my limit, how much should I post, how much should I not post, or should I be doing this event, should I be opening my practice, should I be posting clinical cases, should I place myself on a video explaining some procedures to patients, should I not do it, what will people think of me, I don't have, my voice is not nice, my looks are not nice. Who am I to be saying these things to patients? Who am I? Am I any authority to be able to talk about this? I mean, there's 1,000 different questions that go inside one's mind regarding, and the end, the fear at the end is, what are other people going to think of me, whether they are the patients, whether they are my friends or my colleagues or my family. What is my family going to think of me? What are my friends going to think of me? What are my colleagues going to think of me? What are my patients going to think of me? And I think that's a good way to put it, isn't it?
Yeah, so what you are saying is that we are our biggest critics. So first of all,
Yeah.
before any other person criticize you, and I mean, whatever we
Hmm.
do, whatever you do, someone will always criticize you. Someone
Yes.
will always judge you.
Yeah.
So, but
Yeah.
the first ones, it's to
Yeah.
criticize is ourselves. So we are our biggest critics, right?
Yeah. That first fear comes exactly. It's created by yourself before anybody. Yeah.
Hmm.
Yeah. And I think
And yeah,
it's a good question why we do that, and some of us probably do it more than the others. But I think I think
do
it's
you think it starts to be a projection? Because you know, I remember, for example, when I was starting this business, and when I was
Mhm.
um, trying to move, forward, and
Mhm.
I kept listening to this voice in my head. Oh my God, what's people going to think
Think.
about,
Yeah.
and and I understood that it was like a projection. It was like what I would think about if other person would do this kind of uh, project that I was thinking of developing.
Mhm.
So
Okay.
do you think that we project our fears and our insecurities, our negativity, even
But
to
when
others?
you see when you say you project, what is exactly do you mean? I mean,
The fact that we have these voices in our head, of criticizing
mhm.
ourselves and of thinking, oh, what other people will think. It's
Mhm.
really we that have insecurities, we that have
Yeah,
also
of course.
negativity, we that
Yeah,
have
that's
fears, and we are
true.
just
It's
projecting
true.
that. Hmm.
Yeah, I think that. I think that I think an essential point is to realize that we all have insecurities, and even the people that look the most confident, they have insecurities, or they had more insecurities in the beginning. And I think that I think this is an essential part of understanding, is that everybody has their own inner critic, and exactly like you say, it starts with that. And and of course, things are much more complex because we are social animals, and what
We
other
need
people care of
validation, right?
ourselves.
So yeah.
Yes,
Uh-huh.
of course, yeah.
Hmm.
And what other people think of ourselves, it's an important thing. I mean, this is the way that we self-regulate. I mean, at the end of the spectrum, I mean, if you didn't give a fuck about anyone, you will probably be having like Tourette's syndrome and insulting everybody, or just, I mean, so this is like one. So because we are social animals, we need to respect each other and we need to cooperate with each other. So I think that we think more about other people, what other people think of us, more than what we would like to admit. And I don't think that is always a bad thing. I don't think that is always a bad thing. I think that it is important that that I mean, what other people think of us is also important for us to regulate even the love that we give, isn't it? And the things that we want to create. So I think it is important. I think, but like everything in life, I think it's just a question of balance and when it starts to affect you, right? So if you think, okay, oh, I'm going to do this, or I did this stupid thing, and it just crosses your mind, maybe for a few hours or maybe 1 or 2 days, and it just goes away. I think this is normal, right? And I think that you just have to organize the ideas in order to think, well, is this really important for me to be thinking? Is this going to affect the way that I operate in the world? Okay, so I think this is normal, and I think this. And even, I mean, sometimes you said something to a friend, or you said something to a patient, and you just think about that for a few hours, or a few days, and then you decide that you probably made a mistake. And this is good because you are going to probably probably say that you are sorry, and things are going to be fixed. So I don't think it's necessarily a bad thing to think about what other people think of you. I think, like, just like everything in life, is when that gets out of control, when that affects you, when that causes you anxiety. And I think that the most important thing of all is that when that affects or blocks your ability to give your own offering. And what I mean by your own offering is by giving yourself. I mean, is it can be through your work, it can be through your art, it can be through your photography, it can be through your own self-expression. I think that if someone's thoughts about yourself will prevent you from creating or showing up, or creating a business or opening a practice, well, that is something that deep down you know that you have to do, or you should be doing. Or, well, even the way that you dress. I mean, if there are many people that I know that the way that they dress is a very important part of their self-expression. And I think that if other people's opinions start to affect that, I think then, yes, then you have an issue, and you have to really start to think about that, and work on that. The same thing by opening a practice. What are my colleagues going to think of me? Or the same thing as opening like an education page on Instagram or Facebook, or opening a website, or creating a course, or giving courses on something even outside dentistry, or doing a sport, or whatever. What are going to people think of me when I am lousy in the beginning, while I am surfing, or whatever? And I think that when that gets out of balance, that then there is something that you have to address and to think about that. And I'm sure you're going to think about the ways that you can eventually try to overcome that. But I think that we need to understand that the balance is important. That other people's opinion of us is important up to a point, but after we think about it, if you think that people is not something that is not someone that is really that important, or whose opinion I value, or it's just something that just affects you for a few hours or just a few days, then I think it's also important to think about that, because it's something that you can think about yourself to improve, or even to improve the relationship with that other person. The problem is, I think, is the imbalance when it starts to affect you. and to block you. That's where I think the issues come.
Mhm. Okay, so let's do a differentiation here. So first, you have the criticism, your own criticism, the criticism that it's in your head,
Yes.
and the our
Yeah.
fears and insecurities and what other people are going to think about us. And I think that in
Yeah.
dentistry, that's an issue with a lot of us, because it's
Yes.
still a very closed community, and it still has
Hmm.
a very it's different nowadays, but
Yeah.
it's still you are still very worried about what your peer is going to think about of you.
Yes.
But that criticism is on your head, and I think that we both can say that you have to keep on believing in yourself. Of course, like you said, it's we all we have to worry about what others think of ourselves. It's a regulation
Yeah.
tool, and we need it to feel validated, of course. But you cannot let yourself be frozen by that. You cannot stop
Yeah.
yourself or keep yourself from doing what you believe that you have to offer to the world, and to express
Yes.
your creativity and yourself in that way, just because you are worried about what others people think. So if it
Hmm.
feels right for yourself, I think that regulation is also like a very good way of you knowing what it feels right, because you should not do things just because it's a trend. I mean, everyone. I mean, there was. I don't know if it's still a trend to do like TikTok dances or something, but you don't have to do it just because it's a trend. If
Yes.
you don't
Yeah.
feel that it's right for you. So believe in
Hmm.
yourself, and really do what feel it's right for you, but really don't let those fears and that voice in your head stop you from doing what you think it's right and what you have to offer to the world. But then you put your work out there in the world, and when the work is out there,
Yeah.
what ever that is, and like you said, it can be your clinic, it can be you talking about oral health, it can be you posting your social your cases on social media, it can be a course that you are
Yeah.
start, it can be in a whatever it is, you put it out there. And then it's not only, of course, you take risks, and it's not only the critics in your head. Those critics start to have a voice.
Yeah.
And usually, in my experience, not only in my experience, but also the feedback that I have, the criticism is always much worse in our own minds, because then
Yes. Of
it doesn't
course.
translate that much
Yeah.
in a hard criticism.
Yeah.
But it can happen.
Yeah.
It can happen.
Yeah.
And I think that it's useful, and I always try to remember myself that criticism has as a point, so it can be constructive, so
Hmm.
I can
Yes.
learn from it.
Yes.
Because I in the beginning, I used to be very like offended, I would
Yeah.
take it personally, it was like a defeat for me. It was,
Yeah.
and we as humans have this negativity bias, so if we have one negative comment, or if someone texts you with saying, this, or you should have not done this, or this doesn't look good, or whatever it is, you take that. I used to take that in a very
Yeah.
personal
We
way,
all do.
like when and and so I had to really learn to go through that and to take some positive to learn something from that, even if there is nothing positive about it, but to see it in a
Mm.
constructive way. So how do you do it? How do you deal not with
Okay.
the
Yeah.
voice in your head, but the actual criticism on your
Yeah.
on when your work
I
is
think
out there?
I think what you said is very important in terms of the differentiation between one thing is even before anyone expresses anything about you, what you do to yourself, your own voice, and then what the thing that actually happens in the world. And like you were saying, the thing that actually happens in the world, it's rarely very rarely it is like an aggressive critic. It's mainly in our head. But I like to come back to the first one. So the first one, the voice in your head, I think that you need to have standards of how you want yourself to be and to behave. Because I think that if you don't have standards, you have nothing to compare the things that you are about to do regarding the other people's opinion. Let me give you an example. So, for example, let's say I want to have 3 months of vacation every year, okay? And I know that because I think about what I want in my life on a regular basis, and I write it down. I think I said this in a podcast. I even write it down. I don't think that everybody needs to write things down. Some people have their goals more simplified. This is what I want. This is the way I want to live my life, and their articulation is much more simpler. But I write the stuff that I want my life to be. So when a patient says, "Oh, you're always on vacation," or someone finds, "Oh, yeah, now you don't work. Now you are rich and you are always on vacation." I mean, I completely give absolutely no shit about that, because I know this is something that I want to do and I work for this. So it affects me. It used to affect me, but now it doesn't cross that critic, and that irony does not even cross my mind more than 1 second, because I know exactly that is what I want. That is what I want. And when I say vacation, I see some other things like I want to lecture more. Oh, now you don't see patients. Oh, now you used to see me, now you don't see me anymore. And I used to feel offended. I mean, this is my friend, right? This is my friend, and I stopped seeing him. Most of my closest friends, I still treat them because I want just to chat with them. But many friends I just stopped seeing because it's not possible, because I want to write articles, I want to write a book, I want to give a course, I want to travel. So it's not possible. And because I think so much about the person that I want to be, or the way that I want to improve, I think that's really is the key, to ignore what is not important, right? So I think that the question to control the voice in your head, or to make it your friend or your enemy, is to actually know exactly who you are and who you want to be. And again, we are always going back to the same thing, to meditation, and eventually journaling,
Self-awareness.
and taking some self-awareness, self-conscious. I mean, who is the kind of human being that you want to be? And you may say, well, that's simple. That's something simple. I want to be a good person. It's not that simple. And maybe for some people that are listening, they always knew who they wanted to be, or they always knew exactly who they wanted to be. But honestly, what I think that most of us during our 20s, and even in part in our 30s, we are still navigating exactly what we want to do, and what do we have to offer, right? And I think that I think we have many stages for this, for the persons that we want to be. But of course, that we are ego driven in the first part, and there was even a part of me that when I said to write articles and to eventually write a book or something like it, I mean, just to leave a legacy. And I've just heard something that I even posted recently on Instagram, which is, it's not about leaving a legacy, because you're not going to be around, and it's just, maybe it's not that important to leave a legacy. Of course, there are many people that left important legacies and stuff like that. But I think you should not think about it this way, because if you are thinking about leaving a legacy, you always have the validation of others. And I like the expression of, it's all an offering to God, whatever God is. So if it is an expression of who you are, for example, I love writing down stuff. I love that. And I love traveling, and I love listening to music, and I love thinking about, having interesting conversations with people, and I love eventually helping people that are struggling in dentistry. I love that, and I think, and I know that is my offering, right? And I have that very clear. So if a critic is something that is completely clashing with my offering, then it's irrelevant for me. But if it's something, if it's someone tells me something that I know it is against what I believe is my offering, then I have to listen to that, right? And or if it's something that has to do with my behavior, that look, I don't think that your behavior is correct because of this, with that person, or the other person, or with that patient. I also need to listen to that, because I also think that I have it more or less clear, the kind of relationships and the kind of respect that I want to give to other people, and we are always learning on that. So I think that the first key to control their voice is to, okay, is that voice going to help me, or is that voice gonna be wasting my time? It depends on exactly who do you want to be. And when you know that exactly who do you want to be, I think it becomes very clear of where you should be wasting time, or if you are wasting time, or if it's actually some valuable criticism. So the second part is, okay, so what if the critic is out there? If the critic is out there, I think it's also has to do with, is it being constructive? Does it make sense? For example, some examples that over the past years people have been telling me. Well, regarding my practice, for example, another critic that some guys tell me, look, you don't see the first appointments, you don't see the initial examinations. You would be selling more. I mean, this is a constructive criticism, right? Because they think that I should be selling more treatments if I see the initial patient. Well, yes, it's true, but then I would never be able to have 3 months of vacations. So because I've thought a lot about that, it makes no sense, that criticism, right? But if they say, well, I came here to the practice, and we also do. We also send an SMS after every appointment to ask for feedback for quality control, and if someone writes down something regarding the hygiene, or writes down something regarding the time in the waiting room, or that's also a constructive critic, but that is something that you need to follow up and follow through and see exactly if it makes sense. So I think that you have to, on the one hand, you have to be very safe, you have to be very secure of exactly what the person that you want to be, what is the business that you want to be, what is the kind of practice that you eventually want to offer. But then you also have to be humble enough to be able to understand, well, if this is an objective critic that makes sense, then yes, then I have to change it. And we can eventually talk about some other stuff, which is that sometimes happen, is that when, I mean, and I think that's something that usually makes people it's very disturbing, which is when you hear someone, for example, when you hear comments regarding your practice or regarding yourself or whatever, that have come from other people that you don't know, or that sometimes you don't, that sometimes you know, and stuff like that. Because, like you were saying, the critics, the people that actually tell you things face to face, or leave a comment, or leave a feedback in your practice, I mean, most of the time it's very easy and straightforward to deal with that. And I think that the things that are much more disturbing, and actually this came from one of the girls that was telling me, and that gave me the idea for this theme, was like, well, and then I've heard comments from my friends regarding my posts on Instagram regarding my practice, and that was really disturbing. And I don't know if you see the difference here. So when someone that you know, or a friend or whatever, talks something that is maybe in your back, or maybe you start, I think that her question was like, well, this is the image that I'm passing across in my practice, that people are gossiping about. and I think this is much more disturbing. This is something that really tries to that really disturbs people. And I think that if you get a critic that someone says or whatever, I don't think you should really be paying any attention to that. I mean, because it's, I mean, we've society has, some people argue that language was born out of gossiping, right? Because they knew that they wanted to communicate what was the social dynamics in the groups, right? So I think that we should, the idea that other people think of us, or the gossip that we hear or whatever, I think that is a complete waste of time. And again, if you know exactly who you are and try to improve by treating people the way that you would like to be treated, or by following up on the kind of person that you want to be, I don't think that you should give any bandwidth to what someone else is gossiping about you or whatever, because that will always happen, right? If it's something that is not direct, I don't think we should be really paying any attention to that. Yeah.
Yeah, and with social media nowadays, it's impossible for you to, or if
To be
you,
under the radar,
yeah, I
it's
think it's
impossible.
impossible. If you show yourself, if you want to, even if you don't show anything about your personal life, you don't have to show your house or your training, or even if you don't get
Yeah.
personal, um but you you have, sometimes you have to show yourself, you are the face
Yeah.
of that.
Hmm.
So it's impossible not to have that kind of gossiping, even for your
Yeah.
looks.
Yeah.
She's fat, or she lost weight, or she's wearing this, or she's wearing that. And
Exactly.
it's
Exactly.
it's I mean, nowadays, it's you don't, in the old days there was these magazines, that and nowadays social
Yeah.
media, I mean,
Social
we
media.
all,
Exactly.
it's like
Yeah.
we
Social media, WhatsApp
open,
groups and stuff like
even
that.
if we
Yeah.
don't open the door of our house, it's like you put
Yes.
yourself out there, and that
Yeah.
comes with it,
And
uh,
yeah, and I think that you should, that is something that you should not give too much credit, or this is something that will happen no matter what, and you need to learn to live with that. And I think that every time that you hear someone says, "Oh, this guy says something about you like that is like this," or that guy said something, because it always comes down to your ears. But I mean, you never know if that other person actually said that, or if it was exactly what the context was. And I think you should not really value anything of that. I don't think it's something that is going to make any difference on your life, really. And again, I just think you have to have a vision that is as clear as possible, and an evolving vision of what is the exact message that you want to come across, that you want to pass across in your practice, in your professional career, and in your personal life. And I think that you have to define that. And I think this is really important. Everything else that is not direct to you, that is something indirect, or that you've heard that you are known for this or for that, I think that in my life, personal life and professionally, of course, that I've heard things about me that I don't like, or that I am arrogant while giving the courses or whatever. And I think if someone tells me, look, I think that you crossed the line when you talked about this, this is something that we have to waste time and say, well, does this make sense? But if it's something that you heard, I think it's the same thing as the critic in your head. I mean, is if you know exactly what you did and who you are, or try to improve, I don't think you should be paying any attention to that. Yeah.
mhm. What about, because dentistry has this part also of showing your work in a very direct way,
Yeah.
so of
Yeah.
posting clinical cases. I think that some
Yeah.
colleagues also have issues about that, and insecurities about
Yeah.
that. I don't have. I'm going to be very honest with you. I don't know. I don't know if the idea that I had is based maybe a few years ago, and it's more based like in Facebook groups where sometimes
Okay.
it could be
Yeah.
there was some nasty comments
Yes.
there,
Yes.
and it could
True.
be like almost
Yeah.
very bad environment in some
Aggressive.
Facebook
Yeah.
aggressive environment in some Facebook groups.
Hmm.
I don't know if that still exists. I don't think that's the environment
No,
in
it's
Instagram, for example, when you
yeah.
post a clinical case. I don't see that kind of
Yeah.
comments. I also don't go look for them. But
Yeah.
what do you think about that? Because dentistry has this. You don't see that much
Hmm.
in much other medical specialities. You see maybe
Hmm.
in aesthetics,
Yeah.
dermatology, something, but dentistry has this. So you put your clinical cases out there in a very
Hmm.
direct way. And the thing is that you can get critics, of course, from peers, but you can also get
Yeah.
critics from people that don't know anything about the dentistry. Um, well, how
Yeah.
is that about? Because I
Well,
never done that.
I
So
think that
how
I
is that
jumped
about?
in. Yeah, I think that I jumped 10 years ago. I think it was more or less like 10 years ago. I think I jumped in the forefront of Facebook groups. Actually, the Portuguese group, the Fórum de Casos Clínicos, was one of the most well-known groups in the world regarding clinical case and stuff like that. So I think that Portugal is actually pioneering in that field. And I think that we spent about 2 or 3 or 4 years developing etiquette, the etiquette
Yeah,
of
there were not
yeah,
many now that
because there wasn't any, and people were very aggressive. So, oh, you prep this tooth too much. Oh,
yeah.
that's not the way that you should cement. Oh, you should not be bonding zirconia. I mean, it was a mess. And I think that just like everything, I think that people got more self-aware, and I think that today people realize that every patient is a patient, and you should never criticize a colleague for doing something that maybe you don't agree, because patients are very complex, and sometimes so the way that you decide to do something is always based on your technical ability, on the patient's motivation, hygiene, financial situation, on the available time that you have, on the financial capacity of the patient. So so I think that we have all learned how to navigate that. So yes, I think that etiquette has been developed, and today I think that people are much more conscious, and there's much more respect for that. On the other hand, I think that the clinical discussion, because of that, has also been a little bit reduced, because sometimes in order to be able to
It's
discuss,
just the
you may
before and
eventually.
after. You just have the before and after,
Yes,
right?
yes, yes. There
Mhm.
is not that many. The discussion that used to happen on Facebook groups, I don't think that there is that any longer or anymore. And I also think that it's because there's this widespread. There's just so many things. There's Instagram, then there's people selling courses, then there's it's just exploded, right? Facebook has exploded in terms of dentistry. And the good thing is that yes, we have gained some etiquette. The bad thing is that we have lost those discussions, right? Because sometimes they were very helpful, and helping some colleagues think about this and think about that. And some people, they just learned a lot with that discussion. But to answer your question, I think that etiquette has been developed, and I think that we are crossing a way in social media that is a little bit unknown, right? With all this thing of AI, with this war between Threads and
Twitter.
Twitter. Yeah, and for example, I've never used Twitter, but Twitter is also known to be very aggressive, right? Very aggressive field there. But in dentistry, I think that we have lost quite a lot of discussion. And to be perfectly honest, for example, Instagram, I think it's starting to get too much. Really, it's really there's a lot of dentistry is all over the place. People selling stuff, people showing before and afters. There's dentistry for patients. There's dentistry for colleagues. There's dentistry for courses. I have to say I feel a bit lost. I think it's quite overwhelming, but I think just like everything, just like in the first years of Facebook, we started to gain some etiquette. I think that will be probably each one of us find their own place in dentistry if they want to consume more course contents or more patient or more or just to buy some stuff or just to learn some tips. And I think that the way that I see Instagram, and I think social media is the thing that we known for 10 years. You have to create good content and offer it for free for a vast majority of whatever you are selling. Whatever you have to create good content and selling it for free. You have to give more than you ask for, and to know exactly who that you want to be. So at the end of the day, I think it's really simple. You have to give more, and you have to give it for free. A vast part of your work, of your insights, you have to give them for free. And people that are more like you will eventually find you, because there are out there people that are just for you, right? That are typical consumers that like the way that you see dentistry. Exactly, yeah. And for patients, the same thing. I don't think it's. Maybe I am wrong, because I've never been a clever marketeer, but and some people say that you should be more aggressive in marketing, for example. But that's another example of criticism. Oh, you should market more, and I just don't know how. I just don't feel comfortable, not because of what other people think, but I just don't. It's just not something that convincing people to buy me stuff without telling them why. It's not just something for me. But I think that in the content that you should be doing as a practice, I think that you should differentiate yourself by being very clear of what you are offering, and creating really important and different content so that patients can understand what is a dental implant, what is an orthodontic treatment, how do you see the patients in the first appointment, how do you organize your practice, and give some also valuable tips regarding oral health and general health in general. Because like I am saying, I usually say that we have to get closer to medicine. So I think that we should also be offering more general health advice to the public. This is the way that I see the profession. But again, there are different ways of seeing that. And of course, that you will be criticized,
Hmm.
right? There will
Yeah.
always be some of your peers that will be criticizing you. It's normal.
What about if we go, since we are talking about social media, if we go a step further from criticism, and
Yeah,
we nowadays have what are called a haters.
yeah,
So that's not criticism. That's just
hmm,
you spreading hate
yeah,
on social media,
yeah,
in a way that sometimes you don't even understand why. I
yeah.
never had. I'm going to very straightforward. I never had a situation
Me neither.
like that.
Yeah, but I know
But
I know a few people that have some
hmm
that had some. Yeah,
hmm
I
uh,
know a few people that had some. Yeah.
how I think that first, do you think that you should respond to that, or you should not say anything? You should block. You should respond with kindness. Well, how do you think should be
I I
a good
I
approach?
wish I wish I had an answer for that, but I'm not Buddha, or God, so I don't have the exact answer for that. But I've heard some stories about haters on a personal level, with people that I know, right? Like really some like creating fake profiles and insulting you and stuff like that. I've heard about that. I've
It's just
also heard
free
about
hate and free rage, and like
yeah,
people
because
feel that they
yeah,
can say everything.
yeah,
They don't
yeah,
have to give their face, so they can just spread
Yeah,
hate.
really. And some of the stories that I've heard that are really nasty, and some that make no sense whatsoever. But and yeah, but that is true. Yeah, that is true.
Hmm.
That
Hmm.
happens, and I think in those sorts of situations, sometimes that can even be scary, right? If there is someone that is really being personal on you, I think it can be really scary. And by what I've heard in terms of legal action, there's really almost nothing that you can do about that. I mean, you can denounce it, but there's really not that much things that you can do about that. But those are very rare. On dentistry level, I've heard even recently there happened a very interesting episode between one clinician, a very famous guy, that just invited another dentist that used to prep and extract lots of teeth that probably were not necessary to extract, and basically he was just like asking the guy to come to a circus, and that was very well known in the dental community. And basically he was just there almost like shaming the guy that why are you doing this, why are you prepping so much your teeth, and stuff like that. And eventually it just ended like insulting each other and stuff like that. So the way that I see that is, I don't think
Because
it's needed,
it
like
escalates. It escalates.
yeah,
So
yeah, it was doing
if
like
you
an
respond
Instagram live.
if
Yeah.
you respond on the same
Yeah.
way, hate with hate, then it really
Yeah.
escalates.
Yeah. I think that we dentists, and we all do that mistake, and sometimes some of us do more than others. Um, but I think we tend to have a very narrow view of that, what dentistry is. And it is true that you have to be conservative. For example, in this is a huge discussion in dentistry that it has always been. I mean, how much teeth should I prep? And I know I am a guy that I try to be balanced. I think that there are some younger patients that have good enamel, and you have to be very conservative with that. And I think that's very important. And also in older patients, but I also think that older patients, you should not hugely increase the costs of treatment or make it very complex just because you want to be minimally invasive, because it might not be needed because the patient has an advanced age, or the patient has more things to do, and you have to be more respectful for the patient's money. And I don't always think that you need to be extra conservative. So I think that you have to think for your own head and just not follow any dogmas. So this is an important discussion. But for example, for me, what I don't see discussed in dentistry is, for example, the medical approach, which is okay. So, for example, I cannot do lots of huge full mouth adhesive reconstructions in a patient that does not have any good oral hygiene, right? So I have to treat each patient as a whole, and I have to. The best thing that I can do for that patient is not dental treatment; is just recommendations and the good oral hygiene, and change your diet and do more exercise. And I think that point of view of dentistry is more important, just to see the patient as an individual, right? And when you see these discussions of dentistry in social media, they tend to forget that it's very, very mechanical. Oh, I am biomimetic. Oh, I am conservative. Oh, I do vertical preparations. Oh, I am from Slavisec. Oh, I am from Dawson. I think that's all bullshit. I think that there are many ways of treating a patient, and if I see people get emotionally, if I see that escalation, or if people are criticizing someone because they prep more or they prep less or whatever, I think it's just a complete waste of our existence, because dentistry is important, but the most important thing is to helping the person in front of us. And I think it's one of the most ridiculous things about dentistry that makes us ridicule. We sometimes we behave as it's very ridiculous. That's what I think, that in dentistry, there there sometimes there's 1 millimeter of enamel, and there's or 1 millimeter of papilla, And that can be important for a lot of patients, and it might not be important or relevant for other patients for many different reasons. And at the end of the day, you just have to find what is the best for the patient. And sometimes you may eventually have to refer the patient, but I don't think that you have to have a very strict view on the profession. Some for some patients, yes, you need to do some approaches. For other patients, you need to complete for the same for the same mechanical situation, let's say, from the same structural situation, you may be doing something completely different because of the age, of the patient's finances, of the patient motivation, of the available time, of the patient hygiene, of the patient diet, of the patient medication. So it's very complex, right? So this is why it's very sad to see all this criticism in dentistry. So I think that my advice, if you have some clinical case that you have to share, I mean, you just tell the truth. Look, I did this because of this, and this is why it's important for you to think in a medical way, and not in a mechanical way. And I think that's every option as may have a justification if you know exactly what you are doing. Of course, that you may not be doing stupid situations like extracting perfectly viable tooth and stuff like that. But I think that if you are reasonable, people will be reasonable with you. And if in case of haters, like you were saying, that things that escalate, my opinion is ideally is to get back with kindness, or either block the person, because anything that will change your own state, I think it's a waste of time, and it's just creating a situation that is just it's just emotional, and it will not then you may be creating a really bad energy in the situation or in the discussion. I don't think it makes any sense. So I think it's always better to, in any sort of discussion, say, well, I believe this, and this. But there are always other ways of seeing the world. And if it gets personal, or if it gets insulting, I just think that you should block, and that's it.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, I agree. I think that if you receive that kind of hate, if you respond the same way, then you will be feeding that energy, and things will escalate. You have to really understand if there is something worth responding to, and if you
Yeah.
respond, then try to do it in a maybe
In a kind
even
way, yeah.
in a
As
kind
much as
way. And
possible. Yeah.
yeah, and even you can do smart questions and trying to understand what's trying to unwrap something there, if you think that's the case. Or otherwise, if it's just free hate, and if you feel really threatened or uncomfortable, I think you always have the option of blocking the person, because that's not the kind of energy that you want to
Yes, for
have, and
sure.
that you want to be
Yeah,
exposed to. So I
for
think that's
sure.
that's
For
also
sure.
have to be present, that you have that liberty to do that.
Yeah.
Um, so it's interesting because we talked about, and see if you agree with me. I was just realizing this. We talked about two kinds of criticism: our own
Mm-hmm.
inner voice, right? Our own
Mm-hmm.
the voices that we hear, that we are always criticizing ourselves and thinking what other people will
Mm-hmm.
think of us, and the critics of our peers. So that's the thing for in dentistry. So it's us
Mm-hmm.
and our peers,
Mm-hmm. Yeah.
because
And
in the
the
beginning
patient
I
just a
remember
little
that.
bit.
Yeah, that's what I was saying, because in the beginning I remember we said something like, ah, yeah, we of course I care what my family says and what my friends say, and but in the end, in dentistry, it's
Yes.
very about your the community, right? The
Mm-hmm.
peers, which is very interesting, because I think, and see if you what you think of this, that that's a kind of a bond in the dentistry community. It's the judging, it's the
Yes.
criticism.
Mm-hmm.
It's not the the support. It's not so much. It exists also. I'm not saying it doesn't
Mm-hmm.
exist. It exists also, but it's not the support and motivation. But it's much what you said, the judgment. You mentioned
Yeah.
this in dentistry. There's a lot of judgment. And you even
Mm-hmm.
said we all do it. We all do it.
Yeah.
Doesn't mean that we go and write it or that we
Yeah.
tax that judgment or that critic,
Yeah.
but we all do it.
Mm-hmm.
But that's kind of what connects this community. A lot of what connects this community is this judgment
Mm-hmm.
also that we
Mm-hmm.
have
Yes.
of each other. So that leads to, when we talk about critics, we immediately go to our peers. So what will my colleagues think
Mm-hmm.
of me, or think of this that I'm saying or doing, or that I'm building, or that I'm offering? um, and I think this is very interesting, because,
I think I
like
know
you said,
why.
yeah.
I think I know why that happens.
Tell me.
And we've talked about this many times. Is that we were not trained to work as teams,
Yeah.
contrary to what doctors do in hospitals, for example, where they have to collaborate, right, and really work as a team. There needs to be some communication between specialties. In the operating room, there are several people operating. It's never only one guy. Then you have anesthesiology, you have one surgeon, the second surgeon, you have the nurses, and you have to communicate between specialties, and you have to ask for exams, you have to interpret other people's exams. So the interrelationship and the intercommunication in medicine, and also because medicine works much more within a public context, right? Like, not in a private context. And dentistry has these two characteristics. Like, I probably 99% of dentistry in the world is private, right?
Mm-hmm.
And the vast majority of dentists, they work in very small offices, either alone or with one or two peers. So they are very isolated. And so they were not we are not used to work as a team, right? I think it's changing now, but we are not used to work as a team. And even if we create a team, it's a very close team within one office. So there's
Mm-hmm.
just not that much referral, and there's not much training to work as a team like it happens in hospitals. If you see dentists that work in hospitals, they have a very different. I think they have a more laid back vibe regarding dentistry, because they are working just to provide health. And here in dentistry, we are working to enchant the patient aesthetically in their experience, because it's private, right? And everything that is private is more competitive. And
Competition.
yes, I
Yeah.
don't think that we have, yeah, and we haven't developed that much skills of working as a team. And I don't think it will change that much. I think that seeing the patient as a whole is the way to go. I think that we have to be more medically driven. I think we have to do that, and I think that's going to be something that's going to be very good for dentistry. But yes, this is the core of our profession. We are private mainly, and we work isolated. And even the teams that we do, they are not very big teams, and so there's just
What
not
about
not that much connection with other
what
with other
about
peers.
and to finish, because we we didn't talk about that, because nowadays, and it starts to be more and more of a reality in the medical community also, to have this Google reviews,
Oh
because
yes, yeah,
so
yeah,
Dr. X is this, and Dr. X,
hmm,
I didn't like it because
yeah,
I was not well treated, and this and this and that.
yeah.
So that's a kind of
Critics,
that's a
of course,
critic
yeah,
that's a
yeah,
criticism.
Yeah.
and it evaluates your work and
Yeah.
your clinic in a very direct way. It impacts
Yeah.
your clinic in a very direct way.
Mm-hmm. Mm-hmm.
And there are even certain discussions if in the medical community if you should be rated that way. You know,
Yes. Yeah.
if a professional should be evaluated by stars on Google.
Yes.
So what do you think about that? What because it's more and more a reality. I mean, more in certain countries than others, but I think that we are all going to get there eventually,
Mm-hmm. Mm-hmm.
because it's the same
I
way
think
that you choose a restaurant, right? Based on
yes.
the
Yeah.
Google reviews.
Yeah.
So do you think it's
I think
going to happen also in the industry,
yeah. To a big
or it's already
short
happening?
Sure, I think it is happening, and it's not going to stop. That's one thing. But I think that the first thing that I think that part of criticism from patients, and it's good that we are going to talk about the patient feedback and the patient criticism. I think it's very important, and I advise this to any sort of clinical practice, to have a system where people can provide you feedback anonymously, your patients. And
For
what
you
I have
not
in
be taken by surprise of this online reviews, right?
yes,
So, yeah,
yes,
because if
and also
someone writes
yeah,
that the clinic has is like
yes,
the waiting room
yes,
is dirty or
smelly
something,
or
yeah, or
yeah,
something like that, then you say what?
yes,
And it's
yes, yes.
like they don't know
No
where
one
that
told me.
comes from. So how is
Yeah,
that possible, right? Yeah.
I think, and you can do this for free. You can just, at the end of the day, have a nurse, and sometimes this is integrated in some software, but at the end of the day or the next day, have a nurse just send 3 or 4 SMS. I think they work better, or a link in WhatsApp, and say, well, could you have like 1 minute just to review your experience in yesterday? And you just ask very simple questions just for them to grade them from 1 to 5. Uh, how was the communication at phone or through email? How was the communication when you arrived at the practice? How was the comfort of the practice? How was the communication? How much was the waiting time? How was the communication with the doctor? How is the comfortable by working the doctor? How is the communication? How is the follow up after treatment? Just 5 or 6 questions. This is more or less what I have in my practice. And then just leave a blank and say, look, if you want to identify yourself, you can identify, or if you don't want to identify, you don't want to. And you just do a Google Forms, right? It's free. Just link with a Google Forms. It's free, and then you'll see the statistics. And that is also very important for you to provide objective, unbiased feedback with your team, right? You'll have objective and unbiased feedback with your team. So if they say that the waiting time was too much, so what's going on? Or if someone identifies themselves, so let's see what's going on. Let's see what can we learn from this. So this is the good part of criticism. And I think this is really important, that every practice should have this thing, right? So after every appointment, the next day, just send a text, just send an SMS with a link to a Google Forms, and then you can see the results. It's very simple. It's free. And if you use WhatsApp, it's even free, right? Just 5 minutes of the time of someone in the next day. It's very important that. Okay, so now, what do you do with that feedback? You present on that on the, like we said, on the regular meeting. So now regarding the Google reviews, you can't avoid that. I don't think there's any way of turning that back. For example, France is a much more conservative country in terms of
Yes,
publicity of
it is.
doctors. I mean, you cannot have even the outdoors that you do. There are lots of rules. I mean, it's much more restrictive. I don't know if they can do Google ads or Google reviews or not in France. But France has been they can do, yeah. But the marketing and the publicity is very, very controlled, very tight, right? And I think that I always believe that medicine and dentistry, they should have a different regulation than a hairdresser. I always thought that. I always think about that. Because you really can screw up someone's health if you're not careful doing some invasive procedures. So I think that yes, medicine and dentistry should not have the same sort of permission as an hairdresser. They shouldn't have, with all due respect to hairdressers, because I think there's ethics needs to be somehow controlled by an institution. I believe that because I think you should not leave it completely at the aggressiveness of the market. It should not be like that. But for example, you may say, well, the United States. Well, the United States, there are no rules for publicity and marketing. Yes, there are no rules, but the number of dentists that get inside the country is extremely controlled, right? For example, in Portugal or in Spain, maybe in Greece, maybe in Italy, uh, there's no regulations in marketing and there's no regulations in the number of dentists. And in the US, it's very, very tight. I mean, the profession is taken very, very, very
Yeah,
seriously.
they cannot even move states. They don't have the
No, it's
license
very,
for
it's
the
yes, it's
practicing
and
in another state.
I find that is a good model because it yes, the education is very expensive, but I don't know if you remember a case. There was this guy that was the patient was basically sedated, and he was riding like those Uber skates, and he basically went there. He just took the tooth out of the patient, and someone did a video of him just with a skate on the office with a tooth on the hand. Basically, he was just having like a fun time. He got completely screwed, right? His license was taken away, and he could never practice dentistry in the U.S. again, right? I mean, dentistry and everything that is health related is taken extremely serious in some countries and very lightly in some other countries. And I don't think that there is any way of turning that back in Portugal or in Spain or in Italy or in Greece. I think it's going to be very difficult. But if you go to Germany, maybe in France, maybe in the Netherlands, things are much different. I mean, it's they understand one thing very important, which is you should not be playing around with with people's health because you can really cause some damage. I mean, if someone is taking care of your mouth, they should be really be responsible to see if you have any issue, to teach you how to brush your teeth, to be limiting the sort of procedures that you are doing. And yeah, I think it depends a lot on the countries. But for the Google reviews, I don't think there's any way of going back. I don't really think there is any way of going back. And I don't really believe that governments, because that can always be done, and I don't even believe that governments will ever be able to handle that because it's also you have to be on the internet, and the way that people find you on your browser is through Google, and you just have to have it's impossible. But I think, and some other people also told me that you should encourage your patients, the ones that like the experience, to do Google reviews because that's the way that you get more patients and whatever. Yeah. Yes, I think it's also important. But I think that to have a really very simple process of getting feedback on with an SMS, I think it's something that can really be very helpful and improve the overall service that you have. Yeah,
Okay, I think that we
that was a
covered
good one.
all the topics that I
Yeah,
had here, and I think that yeah, it's always it's not difficult. It's not difficult, but it's always interesting to speak about criticism, and especially when you go further a certain line, and it's now we call it haters, but when it's hard criticism, and even those Google reviews, sometimes they are very
yes,
very
they are
very
very
bad,
nasty.
and we
Yeah,
were saying
yeah,
if you
but
have haters, you should respond with kindness. So if you
but
have Yes, tell me.
But sorry to interrupt. But I've heard many situations where people also need to be responsible for the Google reviews because they can be sued if the practice proves that what that patient was saying is wrong or is false. They can be sued for defamation. They can be sued. And that's something that happens sometimes. I mean, yes, people, they do reviews. So I think that one thing is if you write down a clinical case and stuff like that, and some people hate you, that's one thing. But if people may say something that can be a defamation for your business, or for yourself as a professional, you are entitled to sue them. And I've seen that happen. And I've seen some people being forced to remove their comments because they were not true, and they received some threats, let's say, from lawyers to say that, well, you should have that removed, otherwise we will sue you because we have here our documentation that proves that you were wrong, right? Which is also something very important. People that work in UK, for example, they know that you should write down everything, all the conversations that you had to patients, use informed consents, and just to avoid those sorts of legal problems, right? So you have to, and again, it changes from country to country, but you have to be as careful as possible in terms of informed consents and get all the data and make sure that you write down on your notes exactly everything that you talk to the patient, yeah, and that you providing them alternatives and stuff like that.
Okay, that's very
Yeah,
important. I think that's very important because when we talked about criticism in the beginning, we focused a lot, I mean, on ourselves and on our peers, and that's a lot of ego there, right, in ourselves and on our peers. I think
of
that's
course.
a lot of ego there. But when we go to the other part and patients and also internet and the way that that can really uh, uh, cause damage on your work.
Yeah,
I think that and the internet is a wild west, wild world
far
still.
west. Yeah,
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 so I think it's important to say that because it crosses that line. It's just not a
yeah,
criticism. It's just not something for you to improve because there's always space for improvement. Like you said, you should
yeah,
really track those things down. Don't disregard those reviews. Really understand where
yeah,
they are coming from. But there are certain things that cross the line, and that you should be able
yeah.
to take some action on it. So it's not only criticism, it's more than that. Okay, thank you
All right.
for the nice conversation. Thank you for listening. To the ones that are listening to us, thank you for
Yes,
listening. If you want to join us, please do on our course in Sagres Conscious Leadership course
in October.
in October in Sagres. Yes, go to softbites.online and you have all the information. And that's what we
Hmm.
are bringing. I think that's a little bit more of consciousness to dentistry. And even like you said, this is all about a lot of this, and a lot of this criticism that we talked about has to do, and things get easier if you really know what you want, if you know yourself, if you know
Yes,
your values, if you start aligning all of that in your daily basis, then
yes,
you'll make more, not only the choices that you make will be easier, but also criticism will be much easier to accept from others and from yourself,
yeah,
because like we said, we are our
yes.
biggest critics. So thank you so much, Andrea. Thank you so much for the lovely
Thank
conversation,
you.
and we'll
Thank you.
see you on the next one. Bye bye, everyone. Thank you.
Bye bye.